Mosley was arrested in Cheatham County on Christmas Day, 4 days after the double murder. In one of his earlier court appearances, his lawyers said that Mosley stabbed the men in self-defense.
On COVID-19 watch, Tennessee is seeing decreasing COVID-19 cases as the Delta variant wanes throughohout the state. However, deaths are continuing to rise, and doctors are now cautioning not to let your guard down. News 2's Gerald Harris has more on where the state stands now.
The death toll is rising following several weeks of high positive COVID cases in Tennessee.
The death trends hopefully will turn around, but they're always lagging behind the numbers of cases by several weeks.
But while overall COVID-19 cases are decreasing, it's still higher than what doctors would like, which is bad news for the unvaccinated.
Many of those people, the ones who are going to become ill and later down the line be hospitalized, and ultimately some of those people unfortunately will die. And so this is a process that takes several weeks.
Deaths are often a lagging indicator on how intense and widespread the COVID-19 virus is.
Somewhere between 15 and 20% of people who are getting tested for COVID are actually testing positive. And so that obviously contributes to the number of new cases. And then as they become what we call active cases, a proportion of those go on to be hospitalized and then to die. And so that's why those trends kind of lag behind.
Across the state, hospitals are having to adjust to the rapid increase in deaths. Ballad Health Hospital in East Tennessee writing on Facebook, the flattening of inpatient cases we're seeing right now is unfortunately created in part by a lot of people dying. Additionally, writing, unfortunately, this week we've had to utilize the morgue trailer at Johnson City Medical Center due to the high number of deaths from COVID-19, having 20 deaths there last weekend alone.
The sad and frustrating part is that many of these deaths are preventable. And so people are coming into the hospital and they are dying. And as I mentioned, they're overwhelmingly unvaccinated people, and so this is the burden on the hospitals.
Representative John Ray Clemens, a Nashville Democrat, says the skyrocketing deaths are the results of Governor Bill Lee not having a plan.
The governor has no plan. His only plan has been how to protect his political career. He has not made a policy-based healthcare decision or outlined some plan to save people's lives. And we're seeing the results of that right now.
Reporting in Nashville, I'm Gerald Harris.
Now, we have reached out to Governor Bill Lee's office for comment on the rise in deaths. We've not heard back. According to the state health department, since the start of the COVID-19 pandemic, more than 14,600 people have died in Tennessee.